you?
I'm good. Yeah, thank you so much for asking me to talk. So we've been in contact since I first met Dr. Aurora for a masterclass, and you've been very supportive. And I'm glad I caught that last bit of your talk about mindset, because that was drummed in, and you kept repeating it. I think it's stuck. It's within me. It's the core of what I believe in. So it's brilliant.
Let me just say, for those of you who don't know, Dr. Canh Van On, she's a GP, and yeah, we met, I don't know how many years ago it was now, probably 5, 6, maybe even longer than that, Van. And I still remember a meeting at the masterclass. We did a CSA masterclass, and she volunteered to do a case in front of 100 people, and it's not easy to do that. So I remember it from that day onwards. But it's been a pleasure seeing how she's grown through GP training, how she's got through challenges she's going to talk about now, I'm sure, in the talk. And it's an absolute pleasure to see that now she's on the other side doing some incredible things around neurodiversity, dyslexia. It's just great to see her journey so far, and I know you'll hear a lot about that journey in a very short time period. So Van, over to you, and thank you once again for coming on board.
Thank you. Right, let me just show you my screen. If there's any problems, just let me know, because it's all quite new to me. Right, so I'm talking about how to bounce back from GP exam failure, because I think as medics, it's quite a taboo subject, or, you know, that we're not good enough, or we're not. And I've become quite a bit of an expert on failing my exams. So you'll hear all about that. Whether you failed or not, you know, to become an expert of being failure is, I think, on my part, because out of the failure, I've made successes out of it. So I think it's something to talk about and to embrace and make it normal to actually talk about it. So I've been very lucky to sort of have this platform and to be asked to speak today. So a bit about myself. I'm a portfolio GP. I locum in London and Kent. I've been a GP for 3 years. I had to really think about that. I can't believe it's actually 3 years now. I've become a neurodiversity coach. I've just recently become a TMC PLAB 2 examiner. I'm also a community connector, so doing volunteering work. I've just recently become a JAC creator, who just asked a question. And I myself am neurodiverse. I have central auditory processing deficit. I'm dyslexic and very likely of ADHD. So that's me. So just a quick poll. How many of you have actually failed an exam? So be it a practical exam, a written exam, you know, post GCSE. So just a quick poll.
There you go, Van. 82% have, and 18% have not.
So it's quite common to fail exams, and you know, and I don't know how many people have actually revealed that. I know some of my colleagues are very quiet when they've done an exam, they haven't passed, or oh, don't tell anyone I've taken this exam 7 times. And I think Aurora knows I not boast about it, but I'm very open about the number of times I've had to take my GP exams. So going through, so how you feel, thinking back to when you failed these exams. So how did you feel? What was going through your head? Did you tell anyone? How did your friends, your relatives, your colleagues respond? So maybe if people can put in a few words of what went through, what their experience was.
So we have disappointed, confidence lost, no motivation to start again, felt depressed, no support. Yeah, these are the kind of things that are coming through.
Yeah, brilliant, absolutely brilliant. Okay, so every time you said those words, Aurora, it's not so much flashbacks, very familiar to me, because I went through it so many times, you know. And so this talks about bouncing back. So even going through all those, I had to bounce back, and you know, and some people don't bounce back, but hopefully you'll become a bit more bouncy, as it were, having gone through this talk with me. So my own experience, so GCSEs, did very well, about 11 GCSEs, most of them A's, and then went to A levels, big jump between the two, and I didn't know I was dyslexic at the time, and I sort of gave up. Driving test, that was fine, practical, pass, first go, but to be honest, my driving instructor said, don't worry if you don't pass. So he did have much sort of confidence in me. And some of you may have done the entrance exam for medical school, the finals medical exams, specialty training, etc., and then the big AKT and CSA. So with regards to me, I've talked a bit about the GCSE bit, big jump. So I gave up, went to different careers. So my sort of first failure was the A levels. And then I returned to college just because this is quite late in my life. What people would consider a mature student, which is 23, 24, and that's considered a mature student. So I'd already failed. I went into college because I'd already failed as what I felt was a mother, because I ended up being a single mom, going back to college. My son was very, very young, and I did a course to get access into medicine. And even when I applied for medicine, I felt I failed because I had to apply for London because my support network was there. And all the universities rejected me outright, and I'd already felt I failed. But for some reason, I just carried on. I didn't give up the course. I thought I'll just do it and see how it goes, have a bit of a backup plan. So fortunately, I did very well. I wrote to the universities that ended up getting into a really good London Medical School, and that's another story. I think if you go onto the YouTube video or the blog that I did with Dr. Aurora, it explains that in more detail. So I got into medical school, and I didn't really fail any exams throughout all of that. I think I failed one little module and I retook that, and that was absolutely fine. So even then, I didn't really experience failure as such, but I really struggled. And in the second year, I struggled so much. I got screened. I was diagnosed with dyslexia, and that was a benefit and a hindrance, because then I had every excuse under the sun to keep failing, but I carried on. So I managed to get through, and I really struggled as an F1. So that was another failure, because I felt I really struggled. I passed it, but I just felt out of my depth. I didn't know what the hell was going on. The consultants always looked at me strangely, thinking she doesn't know a thing. So I just felt I was a failure then. And I got into F2 and I applied for a surgical training post with very little surgical experience, and I didn't get into a surgical training post. So I felt I failed again. I was struggling, and then I had to sort of consider, what did I really want to do? No, I still wanted to become an orthopedic surgeon. So I did an F3, which is an additional year as a trust grade in a surgical post. And at the end of the year, I had a meeting with my supervisor, and he looked through, what I did, my portfolio, and he told me, you'll never get onto a surgical training post. That's really knocked my confidence after feeling so bad after my F1. So that didn't help very much. But for some reason, I did manage to get onto a surgical training post when I reapplied the second time round, didn't get on the first round. Just because that whole year I was on call in a London hospital, only surgical doctor on site, and I just learned really quickly, and I did very well. So even for the application, I didn't revise very much, it became automatic, so that really made a difference. But then I decided maybe I don't want to do a surgical post, so I did an F4. It's another year, just enjoying the job. And my friend convinced me to apply for the GP training program. I was very fortunate she did that, because I wouldn't have become a GP. I never thought I'd be a GP. So even with the GP training program to get on, I scraped through the clinical exam, and it was only my clinical judgment and the the stations that I pushed the marks up so well that I got my first choice. So I was very lucky that way. And then I came across the CSA and the AKT, the portfolio, and that was a completely different ball game for me, and I'll go on to talking about that. But before we do, let me go to the next screen. So going through exams and failure, it's very common. So all those things that people talked about, disappointment, upset, disbelief, that sort of thing, it's very common. Whether you wanted something to happen, it didn't happen. There could be tears, anger, shock, feeling very numb, resentful, all your colleagues have passed, sometimes depression, being withdrawn, you feel you're weak, you're defeated, you just want to give up. you feel like a failure sometimes. And I went through all of that throughout my, particularly so throughout my F1, F2 even, right the way through my GP training, to the extent where I did need a lot of support and I had to reach out, for professional support as well. So let's get the next one. So I failed my AKT and my CSA. I failed my AKT 5 times and CSA twice. Okay. And having failed the AKT 3 times, after the ARCP panel, we decided I should do the CSA, which I failed. So with the CSA, I was very, very shocked, because actually I did, I got, I think the maximum mark is 200. I got 43, which was, I was actually gobsmacked. That's another word that people didn't use, but I was absolutely gobsmacked, because the comments were I lacked interpersonal skills. So I know I don't. So exams and reality can be completely different. And it was so bad, I thought, no, that can't be me. I nearly appealed, just because I thought there were someone else's results. But anyway, I didn't, and I just took it on my chin. But having failed the AKT 3 times, every time, the first few times I thought, okay, maybe I didn't work hard enough, making excuses for myself all the time. And it was difficult, because you're working a full-time job. I had a son to look after, I'm a single parent, and the commute was nearly 50 miles round trip, and working that full-time just absolutely shattered. So it is challenging, and everyone has their own challenges, whether you have a family, bereavement, all those sort of things. So it's very challenging to pass specialty exams. So after the 3rd failure, I went to the panel, ARCP panel, and so I turned out there was quite a few of my peers there, and I've been through the panel before. I've been through so many different panels for various reasons. And my colleagues who've only been there for the first time, they said, oh no, how does it all work and things like that. And I was a bit of an expert by then, so I was saying, oh yeah, it'll be fine. And I became quite blasé about everything. So I convinced them to let me retake, and because it was after I failed 3 times, because it was my 4th attempt, they usually tend to move you from a GP practice to another practice. The practice where I worked was very, very supportive, the team, the supervisor, etc. And because I'm dyslexic, being moved around, I have to reorientate. It can take a couple of months to settle in anywhere. I don't like most people, but more so if you're dyslexic or neurodiverse, it's very disrupting. So I managed to convince them to let me stay in the practice. So I had a 6-month extension. So so what happened was I retook the CSA first, then the AKT sort of a month later. So fortunately, with the CSA, I managed to get 117, I think it was. It's not brilliant, but it's a huge disparity from a score of 43 to 117. And then so we waited for about a month for the AKT and the results. And so my colleagues, bless them, they organised a leaving party for me. So we had a leaving party because it's coming to the end of the academic year, and then I'd be fully qualified. And sadly, I failed on the 4th attempt. So this was on the 6-month extension I got, working in the same practice. And at the ARCP, I had met the actual dean who did the ARCP with me. And I was trying to convince him to let me have another attempt, because the previous ARCP, I begged him to stay in the same place. So on the 4th attempt, he was umming and ahhing. It was, I think, at the last minute, he said, okay, I'll give you a 6-month extension, but you have to move to a different surgery. And I actually cried, which surprised me. I actually cried that I'm going to be given another attempt. So they moved me to another surgery, which was even further away. So the commute was even longer. Yeah, so I did that, and it was extremely challenging. I had to reorientate myself again. I got burnt out. I ended up taking time off. I ended up having a meeting with the dean and then my program director. Ended up sort of getting sort of mental health support with the practitioner health, seeing a psychiatrist, and she only discharged me about a year ago. It was that bad, and the dean was so concerned for me. He called me on my mobile and said, "Are you okay?" etc. So it's really important to recognise that it can affect you hugely, and you need to ask for support. Throughout the whole of my training, I was very fortunate. I met on the first rotation my lovely dear friend, who's actually a very experienced GP. She was a year above me. She supported me with my portfolio, my training, just emotional support, and I would be without her, and obviously my team, sort of at the GP surgery. So very important to recognise that, get health support, and in my 6-month extension at the new place, you know, the program director was practically teaching me to learn again, and reading, like learning to read again because of my dyslexia. But before I took that, they actually funded the PSU, the Professional Support Unit, decided I needed to be reassessed with dyslexia, which is, I didn't understand that, but surprise, surprise, I'm still dyslexic. But they did actually fund a dyslexia tutor, and I was very fortunate. I managed to get the same dyslexia support tutor I had throughout medical school and as an F1. So even then, as an F1, I needed that support. So just because personality-wise it helped, and I knew her quite well, it's that familiarity which really helps someone with neurodiversity. Okay, so coping with failure, it's very important to recognise that you do have all these emotions going through. It's very important to let it out, whether you moan to your colleagues or rant and rave to someone. Just choose the right person, because some people can be quite vulnerable, and it seeps into them, especially some of your peers. I was very fortunate because I found my lovely friend who supported me, who's also a GP trainee, but she was a year above me. So she gave me tips and advice, but she got to know me and the way I think, because I'm neurodiverse. She didn't completely understand it, but she knew it was there. So it was always in the background, the way she supported me. I had a moan with my practice manager, my supervisor, my secretary, who I'm staying with now, who's very supportive, the medical secretary. So very important to recognise that these are part of coping with failure. And like I said with Dr. Aurora's talk at the end, mindset is very, very important. Being positive and not letting it get to you. It's easy, it's very challenging. It's easy for me to say that, but remember, I've gone through it so many times, and there is on my final attempt, the positivity and not thinking back about the failures, reflecting on how you can do better, definitely, but taking all those positive things, like, oh, I got a little bit, the marks were slightly better this time, I'll take what I learned from there and improve it with other things, makes a big difference. But you need to have people who are positive around you, not dismissive of your experience, but who will say, no, you'll do this, you can do this. I cannot even put into words how supportive my friend was. You can do this, you're a good GP, because through all my rotations, I've got glowing reports, very clinically safe, knowledgeable, etc. I just need to be able to translate it into an exam. So I managed to get on courses which really suited me, and I did other courses, not just Dr. Aurora's, but his suited me because of his personality, and the options with the audio, with the interactions, and lots of free ones which I really liked, so I could test them, which was the free masterclass I did, and that it suited me because I could play it in the car because my commute was so long. So that's what I did when I evaluated on where I did wrong, and thinking back on, did I work hard enough? Did I work the right way? So in the final attempt, I did think of all those things, and I started very, very early. I made loads of times, but hopefully he would have covered all these exam techniques. And moving forward, it's really important not to put a negative edge to all your experience. They are really, really important. It's part of who you are. And that's why I like to talk about it. Just one, to let people know that there's nothing wrong with that. And a lot of people I've spoken to who've spoken to me, they've dealt with a lot of failures, sometimes even being kicked out of the GP program and years later being called back to do it. There's always options, and those experiences is part of your story, it's part of who you are, and embrace them, grow, and just learn from them. It's really important as a person to be able to cope with setbacks, and move forward and see them for what they are, an experience, and that's it really. So I don't know what else to say about that. And so I'm speeding through this. I hope that's okay. So where to get support, really, really important. I cannot stress. I mean, I was very fortunate. Even when I sort of failed my exams, Dr. Aurora sent me a text and stuff, and when I texted him, I passed. He was really so. And then he organised this interview on the YouTube. So have a look at that. Whoever you can, your peers, your friends, your family, wider circle. A few people have called me through my dyslexic medic. Your educational supervisor, your training program director. Sometimes the options may be that you reduce your hours. Sometimes you just have to do that. I didn't have that option just because I was the sole provider, but it's really important to actually access them. Some deaneries, you can be screened for dyslexia. It depends on where you are. I think in my deanery, you can only be screened after 3 attempts of failure. But other places, one of the program directors I spoke to, who wanted to, which is great, wanted advice on how to support dyslexic trainees. She said they've got it in place where you get screened before and put forward for assessment, that sort of thing. It can be expensive, which is probably why they wait to put you forward for that. So that's a consideration. If you've already got additional adjustments, do make sure they're in place for exams. I think for the CSA for the first attempt, I didn't actually sort of make adjustments. And the second time I did ask for it because I wanted to maximise my opportunity to pass. What's really important is that there is a professional support unit. Every deanery works differently. Sometimes you have to be referred by your program director, sometimes a self-referral. But they have a lot of support available, including study skills, finding dyslexia tutor. So it's worth considering that sort of thing. If there's problems with maybe with depression, clinical stuff, that sort of thing, it's really important to get professional help. And I've accessed the free coaching about careers and things like that. When I was considering sort of moving away from GP. So that support's available in England. There might be other opportunities in other parts of UK as well. So moving forward, like I said, lots of support around me, emotional, professional, and sorry, I'm just trying to look because I've got this hidden. Academic, so very important. And try not to let it get to you. And I know it's difficult, but it doesn't change the fact that it's happened. I think I became very resilient in that way. I said, it's happened now, let's move on. Try to avoid the negative people, negativity. It's like, oh, just people who just put a dampener on things. I'm a very positive person, but sometimes when you're surrounded by those sort of people, especially if they've failed and they keep going on about negativity, you don't need that sort of around you. Reevaluate your exam techniques, your learning styles, try and enjoy what you do. I think it was only in the final AKT that I actually really enjoyed the studying, which is really ironic. And I thought after the GP exams, I've never take another exam in my life again. But sort of 2 years on, I did a very simple exam, but I was racked with nerves. So when I did a community connector course, I had an exam that was nerve-wracking. And now I'm paying for courses and reading and studying. I did a coaching course. So do change your mindset, because that can change your whole outlook and how you approach it. And your learning is much better because you actually take it in a bit better as well. I remember with the CSA, for the first time, I just didn't get it. And it was only sort of between the CSA and the AKT, there was a month between it. But the CSA was actually, the exam was really enjoyable, and which really surprised me. And I knew I did okay. And out of both exams, I knew I did everything I could do. Even on the final attempt, I booked late, so I couldn't get my local examination location. So it was miles away. I had to drive there. So I drove the night before, stayed in the hotel, so I was nice and calm, and just you know, and I thought, I went into the exam, I thought I left it, I did the best I can. And I think I got the results on a Friday. It was about 6 o'clock, I was working late. I wasn't due to doc, thank goodness. And I kept on sort of refreshing the portfolio screen, and then it said pass, and I had to refresh it. Is that correct? And I passed by 0.3%. And then I left my room, went to see my program director who was supervising me. She goes, she looked at me expectantly. She had already known. She looked it up. I said, I passed. I said, only by 0.3%. But I passed, and it was like she gave me a big hug. And then, so yes, it was really, really, really nice. So do enjoy the journey. And that's it. Any questions, any comments?
That was really good, Fan. Thank you so much. That was excellent. Some really, really important points about how to deal with exam failure, and then how to come out the other side, and how to pick yourself up, because it is tough. And obviously we teach a lot of people for exams, AKT, RCA, MSRA, the works, and we see people who struggle to get through at times, and I see the confidence knock, and I see the impact it has, not just on training and picking yourself up to go back to work the next day, but also generally in life, and everything else kind of accumulates, doesn't it, in people's minds, and it's natural. So what you were talking about was great, and you know, it's good that you're doing this and talking about this, because you've obviously been through it. It's easy for someone who's not failed an exam to say, "I'll stay positive," and, you know, do this, do that, and the other. But for someone who's been there and walked through it and got through that difficult stage, you know, credit to you, because it's some comments coming in here. Really inspiring talk, really supportive, great talk, very inspirational. Well done. Keep going. Thank you for sharing your journey. Yeah, you can tell straight away people were finding it of a lot of value.
Oh, thank you so much.
What was that? Can you think back to, of all of those exams, which was the one that hit you the most? Which is the one that where you thought, okay, this is too much now?
Oh, probably the third or the fourth one. And I think maybe the fourth one a bit more, because I did work a lot harder. I felt so probably the fourth attempt. And I think they only gave me the fifth attempt because I passed my CSA, and I passed it with such significant difference. You know, because, and they thought, okay, maybe she can do it. But you know, I really had to beg for it, because I think I was only given the fifth attempt because I have dyslexia. I think most maximum attempts is for fourth attempt, but it was that one because I burnt out. It took so much out of me, Dr. Aurora, where I was feeling very, very depressed. You know, so that's when I sort of contacted the practitioner health, and I managed to get a lovely psychiatrist, and she supported it. But it was really hard to carry on, because what I didn't mention before, throughout all of that, my son was very unwell. He was admitted in hospital, and it was very worrying. So working full time, looking after my son, and then he got a job, and I had to pick him up, and he worked in catering. So after all that long drive, I had to wait about 11 o'clock at night, pick him up from work, and then get. So it was really tough. And I just put one foot in front of the other. Every tiny little step forward is a win, regardless. You get through the day, that's another win. You get through 10 questions, that's a win. See every little sort of progress and win.
Yeah, incredible. And you obviously, you know, you talked about different resources and trying different resources. When did you figure out the style of resource that suited you? And when were you confident to just say, look, you know what, the other styles of learning are not working for me. There's no point me even trying it. Because it's tempting when you get advice from people to do this and the other.
It's very individualized. I mean, I'm still learning how to learn, really, to be quite honest. But I did sort of different resources. I attended sort of face-to-face and different sort of other ones. And some were a bit too academic, and some were very sort of book-based. I'm the sort of person who, I mean, having done the F3 and F4, who needs to experience it. And I think I like going to your courses. I attended, I was there in real person. It's that multi-sensory input that works for me. But you don't want to be starting and exploring that quite late and near exam. You want to, if there's free resources, try it, because you know, they can be quite expensive, these courses. So I mean, because I've retook it so many times, you know, it's very expensive. So try them. free resources. That's what. So I went to the master course. That was free, and give it a go. But once I got on to your course, I just, once you're very personable, and two, it worked for me because it's very interactive, because you did a lot of the webinars and we can ask questions. You made it fun. The pictures were very bright. There wasn't too much information. You made it very interactive, and you had the technique where you introduce it, repeat at the end, and you repeat it again, and that sort of repetition worked for me. So I think give things a go, try things, but very, very early on.
Yeah, I think the sampling thing is really, really important, isn't it? You can't buy something and then sample it. You need to know that it works for you, because these things do cost. You know, our courses are not the cheapest things in the world. That's why we have samples of everything: samples of videos to watch, samples of audios to listen to, samples of mock questions, samples of cards. Go through it, do the research, find what works for you. Don't just get something because somebody else got it. You know, it may not work for you. It's about finding your own style. There's a couple of people asking about dyslexia and you know, saying, well, how do you get assessed for dyslexia in GP training?
So I mean, like I said with the deanery, so some places, I think in Yorkshire, so where the program director is, they screen you before you even take your first exam, which is absolutely brilliant. Other places, I think after a few exams, but there are screening tools on the British Dyslexia Association where you can have an idea of whether you could possibly be dyslexic. And it's a bit like a syndrome where you could be mildly dyslexic, severely dyslexic. It affects people differently. And there's this sort of subheadings of the type of dyslexia. So it's worth doing a screening tool online first. You know, I mean, it depends on how it is. If the deaneries are going to pay you after 3 failed attempts, it's up to you. Do you want to fail 3 times, go through all of that? Because each exam is about £500 for the AKT, and the dyslexia screening is about £600, £700, £800. So do you want that? You might have to privately fund it. So that's down to each individual, really.
It's amazing how many times I've seen in the last 10 years of training for AKT, people find out about dyslexia after their 2nd or 3rd attempt of AKT, because at that point the suggestion is triggered, and the deanery will say, you know, different deaneries and areas have different protocols and plans. But generally, they'll say, okay, if you failed it twice, you should go for dyslexia screening. And lots of people then message me and say, do you think I should? Do you think I should do it? And I say, look, you know, you may not think there's anything wrong, but A, it's being offered by a deanery. So the minimal reason for doing it is that if you don't do it and you fail again, they'll say, well, look, we offered suggestions, but you didn't listen to our suggestions. So it's the bare minimum reason is to do it because you're being told to do it, and you know, at that stage you're looking for all the support that's possible. But probably the more important reason is that lots and lots of people are surprised by the results. They come out saying, I had no idea that this was there for me. And it changes their mindset, because they think, okay, now what? Now I've got something, there's a reason why this might all be happening, and now I can work on this, and I can see light at the end of the tunnel in the next attempt. Whereas otherwise you just go into the next attempt thinking, well, I worked really hard, so why is it going to be different if I work hard this time?
Exactly.
So that is really important, I think.
Yeah, well, the screening is free, so you may as well do it. I mean, you just have to find it online. There's a couple of free ones, and it's really, really important that you do identify how you learn. It's not getting an advantage at extra time. It's to adapt for your disability, because it is a recognised disability.
Yeah, it's a really important thing, and I think neurodiversity and stuff has been talked about a lot more than it was, say, 5 years ago. I think it's a lot more in the open. It's a lot more discussed. There's a lot more suggestion of early screening. Which is quite right, you know, and you know, we try, and the resources that you mentioned with the images and the colors, we try and do things that we know can help. But there are different forms of dyslexia, isn't it? It's not just there's one style. There's different, you know, and often the college can support people in different ways depending on the type that they have. So again, reach out to the college, speak to them. But if you don't do the test, you'll never know, and if you never know, you're going to keep struggling, right?
Yeah. You'd be surprised at how many people have gone through a very different, if they can consultant or something else, but because of GP is so vast and the knowledge base is so huge, they don't even find out until they're in their 40s, and you know, it's mind-boggling how people like prominent surgeons, consultants, and have become you know, diagnosed very late in life. It's absolutely mind-boggling.
Yeah, but you know, it's people like you who are increasing the awareness, who are bringing this more into the forefront. So you know, credit to you. And our next speaker is going to be about the opportunities available in general practice when you come out the other end. So let's just quickly hear a little about the kind of thing, like what are you doing now? What's your week? Because you're the typical portfolio GP who's doing lots of different things. So just tell me a little more detail about where you are and what you're doing.
Well, after I CCT'd, I saw blind that I didn't want to be a locum, neurodiversity, all the paperwork and all the forms and stuff. So what happened was there was another GP registrar who joined me when I should have left and qualified, and he passed with flying colours, so they ended up employing him. So I would have only worked there, even though it's miles away. So I thought, oh, I'll take a bit of a break. And then my friend convinced me to try locum because I could try different places and find this. The environment was really important to me. But then I worked for a month as a locum, and then lockdown happened. I had 3 months of no work and no income. So I started on Instagram and social media, and Dyslexic Medic is mainly to sort of get it out there and let people contact me, which I've been very fortunate, and people have been very open just to support people and have a quick chat, and that's, you know, and I've got great feedback on that. So that's what I did. And then someone sent me a link about a coach, being a coach. So I took on a diploma as a coach. So that's starting to happen as well. So I still locum at my old surgery where I was a registrar. And it's brilliant, you know, supervising people, you know, which I'm in that seat now. And I think after lockdown sort of lifted, I was working 5.5 days a week, you know, and nearly every day as a duty doctor. So exams as a means to end is very important, but it doesn't actually tell you who you are as a clinician. I get very good feedback, and I love my job. So they could have lost a GP who actually loves their job. So there's lots of opportunities. It's very important. Okay, if it's not right for you, leave, but really, really think carefully before you leave, because it opens a lot of doors.
Yeah. Excellent advice, and we're going to hear a lot about the opportunities and how to take them in the next talk. But you're an example of that. You know, you've done some amazing things, and you know, it's a good example of, you know, at that time things are very tough, and you can kind of almost struggle to see where you're going to be in a few years, and even think about what my career is going to look like, because you're so bogged down in the struggle of exams. But it's a great credit of, you know, to show that actually, you know what, in the long scheme of things in your career, it's a small blip. You know, at the moment it seems like a huge deal, but actually it's a small blip. And when you look back at
it, because the blip that you talk about has become part of who I am. So I talk about it all the time, and I became a Jack sort of creator. I just asked a question, which is launches it based on, you know, my dyslexia, and I talk about that. So when it launches, you want to ask me a question, do log on to that. It's a free to use, and it talks about mental health, so if you're struggling. But I think it's after your interview that I thought, okay, I should spread the word, and I don't want people to go through what I did, because it's a very lonely place not passing exams.
Yeah. No, excellent. And just one final question, Van, if you don't mind, for you. What was the recommendation for where you do your free dyslexia screen? What was the place that people need to visit, or the website?
So I went on to the British Dyslexia Association.
Okay, fine, fantastic.
Yeah,
fantastic.
Lots of information there. Fantastic,
brilliant. Van, thank you so much. Incredible talk, lots and lots of positive feedback. I think people have taken a lot away from this, and I'm sure you're going to get people contacting you from here just for some general advice and just for that inspiration that, you know, the person that you become. So thank you so much for your time on a Saturday, and we will catch up very, very soon.
Thank you so much for asking me to join in. Thanks. Bye.
Thanks, man. Bye. Yeah, brilliant talk. And we knew she'd be good. She's always been excellent in the advice that she gives. And like I said, neurodiversity is a thing that is now rightly more being talked about and more being found out, and there's lots of resources and support out there. So if you are a GP trainee and you think that you may want to have a screen, or, you know, think about looking into that area because you may think that possibly that could fit me, speak to your supervisors, speak to your TPDs like Van was saying, and maybe do some of the initial screens, because finding these things can certainly help when it comes around to AKD preparation and other bits and bobs in GP training as well. So yeah, lots of positive comments still coming through, inspirational, great talk. So thank you very much. Right, so I think we're good to move on.